Assalamu alaikum and good morning to my all students. In this semester I will be teaching you Pharmacology Lab 1, that is basic of the experimental pharmacology. So all the experiment in this semester for Pharmacology Lab 1 subjects are demo experiment. None of the experiment it is given you as a hands-on training session or hands-on the experiment. So all are demo experiment, and you are fortunate that this is the online teaching where giving demonstration of the experiment through online mode it is not that difficult. Okay, so let's start with our first practical, that is introduction of experimental pharmacology. I am Professor Sheikh Abu Sufyan. I welcome you to my YouTube channel Pharma Learning. At the end of this e-learning session, you are able to define pharmacology, drug, experimental pharmacology and bioassay, which is prerequisite to understand what is experimental pharmacology and what you are going to do in case of experimental pharmacology experiments. My second learning outcome is explain aim of the experimental pharmacology and discuss how and when to use bioassay. Let's start with the definition of the pharmacology. So the pharmacology, basically it is the science which deal with the study of the drug. So any science which deal with the study of the drug, it is called as pharmacology. And this term pharmacology, it comes from the Greek word that is pharmakon. Okay, so it's come from the Greek word pharmakon. So pharmakon, it means the drug, and second part it is logy. Okay, so pharmaco, and then there is next term, it is the logy. So logy, it means the study. Okay, so pharmakon, it is the drug, and logy, it means the study. So study of the drug, it is called as pharmacology. So when you are studying the drug in the science or studying the science behind the drug, then that subject or that domain of the pharmacy, it is called as pharmacology. It's broadly covered the information about the history and source of the drug. So what is the history behind the drug, how it's come, what is the source, whether it is the herbal source, it is semi-synthetic or the synthetic source. In addition to this, it also includes physiochemical properties. So most of the physiochemical properties that you might have studied in physical pharmacy subject, these properties are also very important with reference to this subject, because based on this property of the drug, there is change in the pharmacokinetic parameters. We'll see what do you mean by pharmacokinetic parameters. So the pharmacology, it broadly covers the information about physiochemical properties of the drug. It also covered physiological and mechanism of action of the drug. Now physiological, the other term for physiological, it is the pharmacology also. So you can say in other word as pharmacological and mechanism of action of the drug. Now try to understand what do you mean by pharmacological action or physiological action, and what do you mean by mechanism of action. So let's take the example of the drug that is well known and you might have used in your in your one or another phase of your life, that is paracetamol. Okay, so I call paracetamol as a para. So if you see the action of the drug, the paracetamol, it is mostly used for the treatment of the fever. So to reduce the fever, you are using paracetamol. Likewise, paracetamol also having certain level of analgesic activity, and at higher dose, it also produces anti-inflammatory action. So analgesic, antipyretic and anti-inflammatory action of the paracetamol, this is nothing but their physiological action. But although it produces antipyretic, analgesic and anti-inflammatory action, but at molecular level, it is doing something else which is responsible for their pharmacological action. Now what it does at molecular level, that is called as mechanism of action. Now in case of paracetamol, what it does, it reduces the level of the prostaglandin, and the prostaglandin, it is responsible for increase in a body temperature. So that is what we call it as a fever. So the prostaglandin is responsible for that increase in a body temperature. It is responsible for the pain, that is called as algesia, right? And it is responsible for the inflammation. So when you reduce the level of the prostaglandin by using paracetamol, right, it will produces this action. Now how paracetamol reduces the prostaglandin? So paracetamol, basically it is the COX inhibitor. So I write it in the short form as a COX-I, that is the COX inhibitor. Now what is COX? COX, it is the cyclooxygenase enzyme which is responsible for synthesis of prostaglandin. Now if COX enzyme it is inhibited, there is no formation of the prostaglandin, and if prostaglandin doesn't form, it won't produces increase in a body temperature, it won't produces pain in the body. In addition to this, it also not produces the inflammation. So I hope you understood this, that the analgesic activity, antipyretic activity, that is decrease in the fever, and anti-inflammatory activity, these are nothing but the physiological or pharmacological action of the paracetamol, whereas inhibition of the COX enzyme, which is responsible for reducing level of prostaglandin, it is nothing but mechanism of action of the drug. So for every drug, you will be studying these parameter, that is pharmacological action and also the mechanism of action of the drug. Likewise, in case of pharmacology, you will be studying another important part, that is called as ADME. Now this term ADME, we will be seeing what is the long form of this. So collectively these four process, that is ADME, it is called as pharmacokinetics. So again I am writing the short form of pharmacokinetic. That is what we have seen. It reduces the fever, it reduces the inflammation, it reduces the pain. So this is what drug does to the body. Now when drug enter into our body, the body will exert certain effect on the drug, and those effects are called as pharmacokinetics. So in the simple language, pharmacokinetic, it is nothing but what body does to the drug. Okay, so what body does to the drug, it is pharmacokinetic. So this pharmacokinetics, it is divided into four different processes. First process, it is A, that is the long form for this, it is the absorption. So let's take how it's happened. So when you take, suppose the oral dose of any tablet, suppose you have taken the paracetamol tablet, you have taken along with the water. So when it goes into your GIT, it undergo the process of disintegration. Means in the water, it will disintegrate into the small particles, right? And after disintegration, it undergo the process of dissolution. So what is dissolution? Dissolution, it is the process where all the drug, it is dissolved in your GIT system, right? So when drug, it is dissolved into your GIT system, now it is present in very smallest fine particles, and these smallest fine particles can absorb from your stomach or your intestine depending upon the nature of the drug. Okay, so it will absorb from your stomach or the intestine, and it goes to the blood circulation. So the movement of the drug from your GIT into systemic circulation, that is blood, it is called as absorption. Okay, so when drug, it is absorbed into your blood circulation, now next process, it is the distribution. So what happened in case of the blood? We have seen that the blood doesn't remain at one place. It keep on moving, it is keep on circulating throughout the body. So during this process of circulation of the blood, the drug, it is distributed at different parts. For example, if you want to induce the sleep, you are taking the sleeping pills. So how you are taking sleeping pills? Does you give the injection of the drug directly into your brain? No, you are not giving drug injection directly into the brain, but you are taking just oral tablet of the sleeping pills. Now what happened? How it is distributed to the brain? It undergo the process of absorption. It absorbs from your GIT, and from GIT, once it is absorbed, it goes into blood circulation, and through blood circulation, it crosses your blood-brain barrier and reach to your brain, isn't it? So now the movements of drug from blood circulation towards the brain, this process, it is called as distribution. Likewise, drug may distribute it into different parts. It may goes into the lipid, it may goes into cardiovascular system, it may goes into your or the muscles, right? So how it is happening? It is moving from blood to different part and different systems of the body. So this process, it is called as a distribution. Now once distribution of drug is over, now drug will exert their pharmacological action or physiological action by the virtue of their specific mechanism, right? So they are having specific mechanism, so it will exert their pharmacological action. Now once pharmacological action it is exerted by that particular drug, then based on their pharmacokinetic parameter, like their T half, that for how much time it remains in the body, right? Then it will move from your blood circulation to the metabolizing organ. So there are different metabolizing organs are present in our body. So major metabolizing organ present in our body, it is the liver. So drug will goes to the liver. Likewise, some drug it is also metabolized in your lungs. It is also metabolized in GIT, but major portion of the drug it is metabolized in your liver. So now what happens in case of metabolism? In case of metabolism, the original structure of drug it is changed, right? So it's convert from their original structure into different metabolites which can be either soluble into a water so that they can be excreted into the urine, or which can be soluble into the bile so that it can be excreted into the feces, right? So this is how this entire process of pharmacokinetic, right from absorption, distribution, metabolism and excretion, it is occur in our body. So this is what body does to the drug. So these parameters are called as pharmacokinetics, which is very important parameter that you are going to study in case of pharmacology as well as experimental pharmacology. Last thing, it is therapeutic use of the drug. Now what do you mean by therapeutic use? Now we have taken the example of paracetamol. Now paracetamol, it is the single drug, but it has having 3 therapeutic uses. So you may have seen you are taking the mitacine, you are taking the dolo, or you are taking the crocin when you are suffering from light headache, isn't it? You are taking sometime aspirin for it. So its main action, it is antipyretic. In addition to that, it can also be used for the analgesic action to relieve the pain, and it can also be used as an anti-inflammatory drug. It having a mild anti-inflammatory action. So these antipyretic, analgesic and the anti-inflammatory actions for which you are using the drug, this is nothing but therapeutic uses of the paracetamol. So I think I have given you ample of example about what do you mean by therapeutic uses, what do you mean by pharmacokinetic, and what do you mean by pharmacology. Okay, so this is just about introduction of the pharmacology. So since we are studying pharmacology and we have seen that the pharmacology, it is the science where you are studying the drug, right? So you must know the definition of the drugs, or you might have studied it in your first year pharmaceutics. What do you mean by drugs? So there are different definitions, but I propose this definition and I have received this definition from a basic pharmacology textbook. Okay, so let's see what do you mean by drugs and try to understand, okay, because drug having particular purpose. So let's see the definition. So the drug, it is a chemical substance used for the purpose of diagnosis, prevention, relief or cure of the disease in a man or the animal. Now let's try to understand the definition of the drug with the case study and the example. Okay, now I have mentioned that there are 4 important terms. One, it is the diagnosis, second is the prevention, third it is the relief, and fourth it is the cure. Now let's see what is the meaning of this. Now suppose the case is that you having the patient is suffering from the colic pain, right? He is suffering from the colic pain, which is pain happens especially in case of intestine and your abdominal cavity. Patient suffering from the weakness, you have seen the nail of that patient, the nail of the patient were yellow in color. Okay, you have seen the eyelid of the patient, right? And you have seen that cavity of the eye, it also become yellow in color. Now physical symptom, based on the physical symptom of the patient and the description given by the patient, you may say that the patient may suffering from the jaundice. Okay, so because these are the symptoms of the jaundice. Now you need to do particular tests to confirm that whatever physical symptoms that you are looking into the patients are there in also in your body, right? So what you will be doing, you will be taking the blood sample and you are going for LFT, that is liver function test, and you did liver function test and you observe that there is increase in level of different liver enzyme like alkaline phosphatase level, it is increased. There is also increase in the bilirubin. Now after this biochemical test with the help of physical examination, now you come to the conclusion that patient is suffering from the jaundice, so you need to give the drug for the treatment of the jaundice. So this entire process of both physical examination and biochemical testing to come to the conclusion of identification of the disease, it is called as a diagnosis. Okay, so you are diagnosing the disease. Now once you diagnose the disease, there are certain disorder which can be prevented. Now for example, you have checked the blood sample, and in the blood sample you observe that there is slight increase in level of your blood glucose. So today you have checked there is increase in level, right? So you thought that it might be due to you may have consumed some sweet, so it may have increase, right? So next what you did to confirm and to show it, what you did is you have checked blood glucose level in next morning as well. So next morning also you have seen there is slight increase in level of the glucose. So slight increase in level of the glucose, that indicate the pre-diabetic condition. Now if you take care at this level, you will not suffer from diabetes in the future, because now you are at the level of pre-diabetic condition. It may convert into diabetic condition or severe diabetic condition if you are not taking preventive medication or you are not taking preventive care. What could be preventive care? Eating less amount of the sweet, doing good amount of the exercise, having good sleep, these are the preventive measures. So the medicine that you are taking to avoid formation of the diabetes in the future, or you are suffering from diabetes in the future, so these medicines are the purpose for the prevention of the diabetes. I hope you understood. Let's say one more example. Nowadays we are there is the COVID-19, and we are in the phase of COVID-19, and we know that during this phase of COVID-19 we need to boost our immunity. So what we are doing, we are taking the vitamin C tablet, we are taking vitamin D capsules for once in a week, so that we are strong enough to fight against COVID-19 virus. Okay, so now what is this? So this treatment that you have taken before you are suffering from the disease, so these type of treatments are called as the preventive treatment. So you have taken this medicine for the prevention of the disease in the future. So one of the purpose of the drug, it is the prevention of disease in the future, right? Likewise, the drug can also relieve the symptom, but certain drug they relieve the symptom, but they does not cure the disease. So let's take the example again of the jaundice. So you have started taking the medicine of the jaundice, and physicians say that you need to take medicine of the jaundice for a week, or maybe for 15 days, or the month, and so, isn't it? You have started taking the medicine of the jaundice, and when you have taken the medicine for a week, and so there are relief of your symptom. Like earlier you are suffering from the weakness, you are suffering from colic pain, and you observe that colic pain, it is reduced. Now that reduced in the colic pain, it is nothing but a relief. It doesn't mean that you are cured from the jaundice. So in order to cure from jaundice, you need to complete your treatment cycle, maybe for a week, 15 days, or maybe for a month, depending upon the severity of jaundice that you are suffering from, right? So there's difference between the relief and the cure. So once you complete your treatment for a month, or whatever time cycle which is prescribed by the physician, then what will happen? The jaundice will be completely cured. Okay, so this is how, with the help of example I have, or with the help of case study, I'm trying to make you understand about the definition of the drug. So the drug, it is a chemical substance which is used for the purpose of the diagnosis, prevention, relief, or cure of the disease in man or the animals, because animal they also suffer from the disease. So this word that is drug, it is basically derived from the French word that is the drogues. So what is the drogues? So drogues, it meaning it is the herb. Why it is called as the herb in French word? Because in case of the earlier system, if we go back into the history, there were no tablets, there were no capsules, there were no syrups are available. So treatment were usually done with the help of different types of the herbs, right? So the earlier the people to the herb for the treatment of particular disease, since it is used for the treatment of particular disease, those herbs are called as the drugs. So that is the reason why the drug, it is the term which is taken from the French word that is the drogue, which is used specially for the herb which are used for the healing purpose. Okay, so these are the basic part of the drug and the pharmacology. Now let's move to our important part, that is the practical about the experimental pharmacology. Now you know what do you mean by pharmacology? That we have seen the pharmacological aspect where we have seen the physiological action, mechanism of action. We have seen the pharmacokinetics, ADME we have seen, right? We have seen the definition of the drug. Now why there is need of experimental pharmacology? Why you need to do the experiment in case of the pharmacology? So let's try to understand it with the help of the aim of experimental pharmacology. So first we will see the aim of the experimental pharmacology. So we will come to know why experimental pharmacology it is needed, and as a pharmacist you must have good hands-on or good skills of experimental pharmacology. So let's see the aim of experimental pharmacology. So first aim of experimental pharmacology, it is to find out a therapeutic agent which is suitable for human use, because there are n number of medicine, right? And you need to keep on searching on new and better therapeutic option. So in case of COVID-19, it is the latest. We know that how desperately the scientists are working on to bring out the vaccine for the COVID-19. Likewise, scientists they are working on the drug which can be used for the treatment of COVID-19. There are different targets are there. So they are working on this, right? So the main aim of experimental pharmacology, it is to find out a therapeutic agent which is suitable for the human use. So this is a very important aim of the experimental pharmacology. Second important parameter by which the experimental pharmacology, it is a very important branch, it is the study of toxicity of the drug. Because if you see the definition of the drug at overdose or maybe high dose, it can be the toxic, or the poison at appropriate dose or toxic substance at appropriate dose can act as a drug. So drug can be a poison or poison can be a drug. It's all depend upon the dose. For example, the digitalis, it is cardiotonic in nature. So you are using in case of the weak herb. But if you take slight increase in dose of digitalis produces cardiac arrest. So the same person who has getting the strength out of digitalis, that patient may die due to digitalis if you increase the dose, right? So that is the reason the study of toxicity of drug is important. And do you think it is possible to study toxicity of the drug directly on the human being? Is it feasible, or do you afford that there is heart failure in the patient? Do you afford there is the completely liver damage of the patient? I think no. Why? Because the per human being, it is very precious. So what you are doing, you study first the toxicity of the drug on the animals, or you are studying nowadays on the zebrafish, or you can study by using different in vitro model or other alternative system, so that there is no need to use even animal also, isn't it? So this toxicity is very important in order to ensure the safety of that drug in the human being. Okay, otherwise if you are giving the drug and if that drug it does not produces the safe effect, instead of producing good effect, it produces very severe adverse effect which is life threatening. So instead of saving life, that patient may die. So that is the reason why you must study the toxicity of the drug in case of pharmacology. Third aim, it is study of the mechanism and site of action of the drug. So in order to appropriately administer drug and to optimize pharmacological action of the drug, pharmacologist, physician must know how drug works, how it produces pharmacological action. So we have seen in case of paracetamol, it inhibits COX enzyme, it reduces the level of the prostaglandin. So this is called as mechanism action. Likewise, we must know what is site of action, so that instead of exposing drug to entire body, we can expose drug to that particular site. For example, if you want to have the action of the drug only on the liver, now you can develop the targeted formulation which are going only into the liver. If you want to have anti-cancer action, then you know that what anti-cancer drugs are doing. Anti-cancer drug, they basically kill the cancerous cell, right? But when you expose that drug to entire body, in addition to cancerous cell, your body cells are also killed due to anti-cancer drug. Now, if you have the knowledge of site of action of drug, now you develop targeted drug delivery system, which is not going into the normal cell, but it is only targeting cancerous cell, isn't it? So if it only target cancer cell, then you are saving your other normal cell. So you can optimize the drug. You can reduce the side effect of the drug only after using the principle of experimental pharmacology. So these are very important aim of the experimental pharmacology for which you are studying this subject. Let's see the stages of studying the action of the drug. What are the different stages for studying the action of the drug? Do you study directly on the human being, or first you start with some in vitro test, then you are going into the animal? Let's see that. So first it is done in two main stages. So first stage, it is preclinical experimental pharmacology. Now try to understand what do you mean by preclinical. Why this word it is mentioned as a preclinical. So to understand this, you must first know what is the meaning of the clinical. Clinical means when you are giving anything to the patient, or when experiment it is done on the patient or human volunteers. So human being coming into the picture. So when you are doing experiment on the human being directly, that is called as the clinical experiment. So we call it as the clinical trials, or we call it as the clinical research. So before doing clinical research, you are doing the study of the drug on the animal. So this study, it is called as the preclinical experimental pharmacology. Why? Because this study it is done before clinical trial. Since you are doing this study before clinical trial, it is called as the preclinical experimental pharmacology. Now let's see what we are doing in preclinical experimental pharmacology. So in case of preclinical study, we are doing identification and optimization of novel chemical lead structure. Now you have certain chemicals with you, but you don't know whether it having good pharmacological action, whether it can be used as a drug or it cannot be used as a drug. Or you having some background information, maybe your grandmother or your grandpa using some herbs for treatment of some illness when you. So if you remember that particular therapy and now the grandpa it is no more, right? So you don't know what is the logic behind using that. Now if you want to explore that, let's try that on the animal model. You test it on the animal model, give the injection, give oral dose and see whether that drug or whether that chemical which were used by your grandpa or your grandmother for killing your illness in the childhood, whether it having certain pharmacological action or not. Okay. So to do this, what you are doing, you are giving the drug to the animals. So you are doing testing on the animal or the animal tissue or the organs, okay, so that you will come to know whether drug having biological action or not. Okay. So basically in case of preclinical experimental pharmacology, there is identification and optimization of novel chemical structure, means new drug by testing on the animals and animal tissue or organs for their biological action. Okay, so this is what you are doing in case of preclinical experimental pharmacology. Now let's see what we do in stage 2. So we have seen the stage 1. So stage 1 it is preclinical experimental pharmacology. Stage 2 it is the clinical pharmacology. So in clinical pharmacology, you are testing drug on human volunteers or the patient. So that is I have already mentioned. So when you test the drug on human volunteers and the patient, that testing it is called as the clinical pharmacology, and you also call it the clinical trial. And there are different phases of clinical trials are there: phase 1, phase 2, phase 3, phase 4. So these phases you will be seeing in the detail in the final year clinical pharmacy subject. So for just now, for time being, you remember that the clinical pharmacology, it is nothing but the testing of the drug on the human volunteers and the patients. Okay. So why you are doing this? Why you are giving the drug to the for testing on the human volunteers and patient? Because you want to assess their pharmacokinetics, their safety and efficacy in the human. So all pharmacological parameters, pharmacology, pharmacokinetics, that is ADME profile, that is safety, whether drug it is safe or not, whether drug it is efficacious or not, whether it having effect or not. So that is all you evaluate in human being as well. So in addition to animal model, you also evaluate that on human being. Okay. So we have seen two stages of experimental pharmacology. First stage it is the preclinical stage. Second stage it is the clinical pharmacology, where you are giving the drug to the human volunteers and the patients. Okay. So I have done with my first part. So before moving towards second parts, let's have very short question and answer session. So I request you to write your answer in a chat box. You use chat box to write the answer. You give me some time to display on the question for today's quiz. I can see your chat box. So my first question is, it is the fill in the blank. Pharmacology is the science which deals with dot dot dot. So you have to write your answer in the chat box. I am waiting for your answer. Come on, let's see who give first answer. So the one who give first answer deserve appreciation. Very good. So Nida is the first to give the answer. I want everyone to give the answer. Let's see how many of you are awake. If all 24 are awake, it means there must be 24 answer from everyone. So many of you have given the right answer. The first answer who has given the Nida. Yes, very good Nida. Nida has given the first answer. It is the study of the drug. So the question was very simple. That is, what do you mean by pharmacology? So that is what I have asked in the fill in the blanks. Okay. My next question is, what are the different aspects of the drug covered in pharmacology? Or in other way, I may ask you, what are different things that you study in the pharmacology? Yes, Sania has given first answer. It is ADME. Yes, you are right. So ADME we study. That is absorption, distribution, metabolism, excretion. That is study of pharmacokinetics. Yes, Sumaya has mentioned another new thing, that is physiochemical reaction. It is not a reaction. Basically, it is physiochemical properties. We doesn't study reaction. We study physiochemical properties. Mansi has mentioned history, source, physiochemical properties, ADME, physiological and mechanism of action. Very good, Mansi. You have summarized, I think, almost all parameters, but still we have missed the last one, last but very important parameter of pharmacology. I think Tasneen Siddiqui has mentioned. Very good, Tasneen. She has written that therapeutic uses. Very good, very nice. We are studying therapeutic usage of the drug. Very good. My last question is, give aim of experimental pharmacology. We have seen there are three aims of experimental pharmacology. So maybe you can write all three, or one by one you can just write it. So let's see who give the answer first. Aim of experimental pharmacology. Yes, Irshad Hamid has mentioned the aim of experimental pharmacology. Find out therapeutic agents suitable for human study. Very good. Study of toxicity of drug. Yes, we are using it for study of toxicity of drug. Study of mechanism and site of action of drug. Okay, so there are three important aim. Very good, Irshad. You have summarized all three aim of the experimental pharmacology. So I'm moving to the second part of the session. So till now, we have seen the very basic part of the pharmacology. We have seen what do you mean by pharmacology, why we are using experimental pharmacology, why it is important, what you study in experimental pharmacology. So that we have studied in our first part of the session. Now in our second part, we will see about the bioassays. Now what do you mean by bioassays? So first I will put the definition of bioassay. So I have divided the definition of bioassay into three parts so that it becomes easy for you to understand. So biological standardization or bioassay. So basically bioassay, it is nothing but biological standardization. Like you do the chemical assay. So that is called as chemical standardization, right? But when you use something, some living thing to do this assay or to standardize your drug, then these assay are called as biological standardization or bioassay. Let's see theoretic definition of the bioassay. So the bioassay or biological standardization are the procedure by which the potency or nature of substance it is estimated by using or by studying its effect on the living matters. So what you have used? You have used the living matters to study the potency and nature of the substance. Now try to understand what do you mean by potency. Let's take the example. I will give you example of two important sedative and hypnotic drugs. One drug, it is alprazolam. So I write here as alprazolam. Okay. And second drug, it is lorazepam. So alprazolam and lorazepam, these are two sedative and hypnotic drugs. So to induce the sleep, in case of lorazepam, the dose of lorazepam, it depends upon type of insomnia. So we will be talking about severe insomnia. Means patient is unable to sleep in spite of taking all the efforts. It is called as insomnia. So in case of lorazepam, you need to give the dose between 2 milligram to something which is called as 3 milligram. So you need to give the dose of 2 milligram to 3 milligram to induce the sleep in case of severely insomniac patient. Whereas in case of alprazolam, the 1 milligram of alprazolam or lesser than 1 milligram, it is sufficient to induce the sleep. Now try to understand what do you mean by potency by taking these two examples. So alprazolam to induce the sleep, you need the dose of just 1 milligram. In case of lorazepam to induce the sleep, you need little higher dose of 2 milligram to 3 milligram. So the potency, it is the quantitative term which is used to indicate the effectiveness of the drug at particular dose, isn't it? So in case of alprazolam and lorazepam, which one is more potent? So the drug which having the less dose, it is more potent. So here in case of these two drugs, alprazolam need less dose to induce the sleep, that is 1 milligram. It means alprazolam, it is more potent as compared to lorazepam, because lorazepam need higher dose, isn't it? So the low dose, it indicate more potency. If more dose is there, it indicate drug it is less potent, isn't it? So the potency and dose are inversely proportional, right? So to understand this relationship between the dose and their effect, the term which is used in case of pharmacology, it is called as the potency. So you are studying the potency and you are also studying the nature of substance. Now what nature of substance you will come to know with the help of bioassay. Like the drug, it is producing analgesic effect. The drug, it having the antipyretic effect. So what this indicate? This indicate the nature of the substance. Whether it is analgesic, whether it is antipyretic, or the drug having all three action. That is analgesic, anti-inflammatory and antipyretic drug. So these are all effect you will come to know with the help of assay that you are doing on the living system or living matters, and these assay are called as the bioassay, isn't it? What you did in chemical assay, in case of titrimetric assay, you have tried to understand how much ml of the NaOH it is required or HCl is required to come to the end point. Likewise, you did the purity assay in case of the PIC subject, where you might have studied that how much drug it is pure, whether it is 99.9% pure or it is 98% pure. So you did the assay. So likewise, you calculate the potency and you study the nature of the substance with the help of living matters. So these assays are called as a bioassay. Now let's see how to done bioassay or how to do the bioassay. So bioassay are generally done using animal tissue or organs. Example, guinea pig ileum for the estimation of the histamine. So this is one example because you are using what? You are using animal tissue or the organ for studying the biological assay. So you have used here the guinea pig ileum. Likewise, in your higher grade pharmacology practical, you will be doing the biological assay by using the cock ileum or hen's ileum. So what you did, you have estimated the concentration of the histamine by using the particular body organs or the tissue, or you may use whole organ, like you can use the mice, you can use the rat, you can use the zebrafish for study of their pharmacological action. Okay, so you can use either animal tissue or organ, or you may use intact animal. For example, in case of the bioassay of the insulin, so what you did in bioassay of insulin, you need to first induce the diabetes in the animal, and then you will be giving the dose of insulin to the live animal and check the blood glucose level. So you will come to know how much amount of blood glucose level it is decreased by the insulin, right? So since you have used here intact animal. Likewise, you will be using digitalis, right? In case of digitalis, you are using the guinea pig, and you study at what dose digitalis having cardiotonic effect and at what dose digitalis having cardiotoxic effect, isn't it? So you will come to know the digitalis cardiotonic and cardiotoxic effect by using the live guinea pig. So you are keep on increasing the dose of the digitalis till the extent that guinea pig suffer from heart arrest. So the point or the concentration where the the guinea pig suffering from the heart arrest, it is the cardiotoxic dose of the digitalis, right? Likewise, you can study the effect of digitalis on isolated herd. You can isolate herd, you give the different dose of the digitalis, and a different concentration, you can verify how it help you to pump your cardiovascular system, right? So you can do the bioassay by using animal tissue, organs, or by using intact animals. Let's see when to use bioassay, in which condition you must go for bioassay. So bioassay procedure are generally employed when chemical assay of substance is not available. Now what are those cases where chemical assays of substance are not available? Let's see the case of this in second example. So where substances get inactivated by interacting with other chemicals, right? So in case of chemical assay, what is needed? So in chemical assay, you need to add other chemical to do the bioassay. Like in case of acid base assay, you are adding, in case of acid, you are adding NaOH, you are adding phenolphthalein. So during this process of the titometric assay, what is happening? Now acid, it is no more acid, right? Whereas your NaOH, which is basic in nature, it is no more NaOH. Now it come to the pH that is the neutral at particular point, and it show your color that is pink color. So during the process, there is inactivation of the drug. So if there are drugs which are inactivated by their interaction with the chemicals, in case of chemical assay, for example, in case of the hormones, these are very sensitive and they are generally inactivated, then in such case, only option available is you need to go for the bioassay. Okay, so this is the second case. Third case, when the quantity of sample is too small. Now you have used a ton of herbs to produce just 1 milligram of your drug. So out of tons of leaf, you have extracted 1 milligram of drug. You have spent almost 3 months to do this, right? Now sample available, it is very small and it is very precious. Now in such case, you cannot waste those sample by using chemical bioassay, because your sample will go into vein, it will be degraded, isn't it? So there are different bioassay procedure available, like matching bioassay, bracketing bioassay, where you need very small amount of the sample, right? And there are some bioassay procedure available where after bioassay you can recover the drug by process of recrystallization or the crystallization, isn't it? So this is why you need to use the bioassay. So third case, when quantity of the sample is too small, then you need to go for bioassay. Fourth point, to estimate the concentration of active principle present in the tissue extract. The endogenous mediator like acetylcholine, 5-HT and prostaglandin. So this you will be doing by using the tissue, right? And this is there in your pharmacology lab 2 practical, where you are determining unknown concentration of acetylcholine, unknown concentration of the atropine by using cork ileum. So what you are doing, you mount cork ileum in a physiological salt solution where it remains alive, right? So the hence ileum or cork ileum you are mounted. Now you are giving the drug and you are checking how much of a contraction it produced. The contraction it is indicated with the responses something like this. Okay, so there is increase in a dose may lead to increase in the response, right? And this DRC, that is the dose response curve, help you to calculate unknown concentration of active principles. So this, with the help of this, you can calculate unknown concentration of active principle. So this is the reason why you are using the bioassay, right? So this is one more reason for to use the bioassay. Fifth one, to measure pharmacological activity of new or chemically unidentified substances. Like if you don't know their pharmacological action, so you are giving that drug onto the animal and you are verifying their pharmacological action, what it does, whether it having action on the CNS, whether it having the action on the cardiovascular system, right, or whether it produces the thinning of the blood. So this is what all these parameters you can study by using bioassay. Sixth one, to measure the drug toxicity. So we have seen we had ample of discussion on this. Seventh one, it is when the bioassay is more sensitive than chemical assay. Like you have chemical assay, but chemical assay it is not as sensitive method. It is not as accurate as the bioassay. Then in those cases, you can also go for the bioassays, where you are using animal or tissue to study the effect of the drug, right? So we have seen with when to study the bioassay or in which cases you have to go for the bioassay, right? That we have seen. Now let's quickly see what are the types of bioassay. So there are different types of bioassay. First, it is the quintal. Now what do you mean by quintal bioassay? So in very simple word, you must remember that the quintal bioassay is also called as all or none bioassay. Okay, all or none bioassay. Let's take example. We have just now seen the example of digitalis. Digitalis, you are giving in case of guinea pig to study their cardiotoxic and cardiotonic effect. Now, at particular dose, digitalis produces cardiotoxic effect, right? Below that dose, it won't produce cardiotoxic effect. So at particular dose, if it is producing cardiotoxic effect, right? So that dose where it produces the effect, it is called as all effect. Whereas all the dose below that, right? All the dose below that, so all those doses of digitalis below the dose which produces cardiotoxic effect, it is called as the non-response. So when in case of bioassay, your nature of study it is such that it give either response or no response, right? So at particular dose produces the response, below that it doesn't produce the response. Such type of bioassay are called as the quintal bioassay. I hope you understood, right? Second bioassay, it is graded bioassay. Now graded bioassay, I have I have drawn you the dose response curve and I have tried to make you understand. So in case of graded bioassay, when you increase the dose, there is increase in a response, right? So increase in a dose, when it lead to increase in a response, now you can see in such case of bioassay are called as graded bioassay, right? Where change in the dose may lead to change in the response. Whereas in quintal, although you have increased the dose, but there is no response up to certain point, up to certain point, and it produces response only after certain point. So now these bioassay are called as the graded bioassay. Okay. Next bioassay is in vivo bioassay. When you are giving drug on the live intact animal, those bioassay are called as in vivo bioassay because drug it is given to the intact animal. Fourth category is ex vivo. Now suppose what you did is you have not given drug to the intact animal. You have isolated, means you have sacrificed that animal, and from that animal you have isolated hurt, right? So you have isolated hurt outside the body. Now hurt it is present outside the body you have mounted in a ringer solution, which is physiological salt solution, right? And you have given the drug, like you have given the adrenaline, and you have checked how much heart it is pumping. Now what you did, the live heart, right, you have removed from the body and mounted outside the body environment. You have given physiological salt solution, that is ringer solution, to keep that heart alive, right, and you are giving the drug. So these type of bioassay are called as ex vivo bioassay. Likewise, in case of cock ileum or the hens ileum practical that you are doing in final year, there also what you are doing, you are using the ileum, that is small part of the GIT, and you are giving the dose of the acetylcholine to see how it produces the contraction. So what you did, you have removed ileum and maintain outside the body, their liveliness it is maintained, and then you have tested that drug. Then such type of bioassay are called as ex vivo bioassay. Likewise, last one, it is called as in vitro bioassay, where you have not used any body organ or body tissue, but you are doing this bioassay in a test tube. For example, you have taken the hormone and you checked how your drug working with the hormone, or you want to check your enzyme inhibitory activity, like, and there are some in vitro assays are available for anti-diabetic effect, like alpha glucosidase inhibitory effect, right, alpha amylase inhibitory effect. So these are the enzyme that you are using. You are incubating drug with this enzyme, and then you measure by using UV spectrophotometer. So at particular concentration or particular inhibition, in case of in vitro bioassay, when you incubate drug with alpha glucosidase enzyme, if it having inhibitory effect, then it will change the color to that extent. Suppose if it produce the pink color, if it having more alpha inhibitory or alpha glucosidase inhibitory activity, it will produces very strong pink color, right? It having less activity, it will produce a very less pink color, and this color intensity you can measure by using colorimetry or by using UV spectrophotometer. So nothing live you have used in case of in vitro bioassay. So this is also called as the test tube bioassay, where you may use enzyme, hormones, you can incubate with the drug and verify the effect of the drug, right? So these are the 5 types of bioassay: quintal, graded, in vivo, ex vivo, and in vitro bioassay. Okay. So I have done with my today's sessions. Thanks for watching the session. If you like my session, then do remember to give me a thumbs up. And for more such learning, subscribe to my channel.